Hey everybody, welcome to Autism Awakening, the podcast that helps you help your child with autism. I'm Dr. Jared Skowron, and today we're going to be talking about autism diets. Obviously, different diets for kids on the spectrum is a huge conversation. A lot of people doing it, a lot of people talking about it, a lot of people wondering, is this going to be something that's good for my child? So we're going to get into diets today. Now, for those of you who are regular listeners, this is the end of February and we're having some super fun celebrations. Spectrum Awakening is turning 10 years old. So we're having a lot of stuff and celebrations and giveaways going on with that. 2 days ago was my birthday. I turned the big 50. So today, if you're watching video wise, I got my vintage 1974 t-shirt on, to celebrate the big 50. And we've got a lot more to help you guys out along the way. So today for you live viewers, is going to be a little bit of a shorter podcast. I've got to wrap up in about 40 minutes, but this is a pretty concise topic. So we'll be able to get it done pretty quickly. Now, let me talk in general as I normally do, and then kind of get into our scientific research. And a lot of people are going to ask a lot of questions about diets, and I'm going to be giving you the answers that you probably don't want to hear. And the answers that you don't want to hear are, number one, yes, you should try different diets with your children. Okay? That's the answer a lot of people don't want to hear. Answer number two is there is no one perfect diet. And everybody wants that perfect diet because everybody wants the easy answer. And unfortunately, there just isn't an easy answer to all this. The autism diet question is a very complicated, it's not complicated, it's a very individualized answer. And I'm going to get into why about that. First, I want to give a live shout out to Carla. Carla, hello from Florida. I was down in Orlando this past weekend for our birthday, and it was my daughter's spring break. Not spring break, but, winter break. So we went down to Universal. And man, the rain this weekend in Orlando, we got washed out of Diagon Alley and Hogsmeade. But it was fun. It was always fun to go away. All right, let's get into this autism diet question, remembering that the answers are mostly going to be yes, you should do it, and there is no one perfect diet. There is none. So let me, in general, review autism diets, then we'll get into the research, and we'll answer some live questions. Okay, number one, you are what you eat, period, okay? You are what you eat, everything that is us, and I talk about this a lot on the different podcasts. Everything from my skin to my bones to my brain to my emotions, these are all from the foods that we eat. We are made from the foods we eat, the air we breathe, and the water we drink, period, okay? Now, all foods out there, we don't react to the same way, all right? We are all different people, and we all have different relationships with different foods. And I'm not talking about emotionally, and I'm just talking about physically, okay? Guess what? Some people are allergic to peanuts, all right? How many times you get on an airplane, be like, well, there's no peanuts today because we have somebody who's allergic, all right? That one person might be massively allergic to peanuts, and they may die. The rest of us will be totally fine. Okay, very similar for people who have celiac disease, and for them, a tiny piece of bread or a cracker is going to be horrific for them, but for the rest of us, pretty okay, all right? Everybody's different in the way that they interact with food. So I wanted to review the different ways that we can interact with food physically, okay? And then we can kind of springboard from there into what type of diets should we try with our kids. And I completely understand our kids are picky eaters. So doing these elimination diets with some kids can be difficult. I understand that, all right? With a lot of my patients. And again, for those of you who are new to Spectrum Awakening, I've been an autism biomedical doctor for 20 years and talking diets with a lot of our patients and a lot of our families. And for some, it's easy to introduce, and for others, it's hard because some of our kids have such restricted diets, and you don't want to take a food away for them to never get back. Okay, I had a patient once, all he ate was bacon. That's the only thing he would eat was bacon all day long. And if we had a no pork diet, well, what's that kid going to eat? Okay, so, and there's other people who say, well, you know what? You just got to force it. You just have to, take those foods away and let them go on a hunger strike and be done with it, and man, that sometimes that works, sometimes not. I mean, I had a patient, And shout out to T-Rex out there. They put him on a 7-day, diet, and he went on a hunger strike. They're like, here's all the food you can eat. And he on that hunger strike for days and days and days, to the point where, well, geez, the kid's got to eat. So it's tough. And I understand that challenge of toughness. But regardless of how tough it is, we still have to do it sometime along our autism journey. Okay? And that's really the point. If you're going to do these diets, you need to try them, and you need to be in 100% in order to say that, hey, you know what, I did try this. So let me give you a couple other anecdotes, and then we'll kind of drop in. Number one, this is my favorite food anecdote and food story. So, and this was a long time ago. I mean, this has to be going back like 15 years. I want to say like 2007. So what is that? That was 17 years ago. So I had a patient, he was 3 years old, he was nonverbal on the spectrum, and we had talked through with the family, and they wanted to try gluten-free diets. Great. Okay, let's try gluten-free diets. And my rule, if you're going to try a diet, it's 100%. All right? 70% doesn't work. Okay? Being gluten-free, dairy-free, except on Fridays, because we always have pizza, doesn't work. Period. All right? So you have to be 100%. So this kid went gluten-free 100%, and guess what? In 1 month, he started talking. He went from nonverbal to words in 30 days by going gluten-free. Amazing. I love it. Okay? He did that for a while, and then one day, Grandma and Grandpa took him to McDonald's. And, Grandma and Grandpa were great. They said, hey, what at McDonald's is gluten-free? They said, oh, French fries. Potatoes? The potatoes are gluten-free. Let's do it. Unfortunately, the flavoring that they use at McDonald's and other restaurants, that flavoring had gluten, okay? So the child ate the French fries and stopped talking that day, okay? And it took an entire month of 100% gluten-free to get back to that language. So the point in that story is, number one, diets can work, all right? I have literally seen it in thousands of kids. Diets can help your child improve their language, their behavior, their mood, you name it, their GI symptoms. But the other point of the story is you have to be 100%. You need to be 100% for a certain period of time, or else you really haven't tried it. And another anecdote, I was talking to a family in my office, and we go over, hey, what have you done with your child before? Have you done any meds, any kind of therapies, any kind of treatments, any kind of supplements, whatever? And said, have you tried the diets? And they said, yes. I said, well, which diet? And they said, well, we tried gluten-free. I said, that's great. How long did you do it? He said, 1 day. We tried it for 1 day. I'm like, well, that's awesome. And that's a good start, but it's not enough. We need it longer, okay? So let's go from those anecdotes to kind of understanding the science and the biology of how our bodies react to food, okay? Number one, and I tried to type this out so you could just kind of see it verbally here, okay? Number one, food responses. We got 4 different food responses we're going to talk about today: digestion, allergies, sensitivities, and autoimmune reactions. Let's first talk about digestion, okay? We need to be able to digest our food. All right. We need to digest our food, to digest the fats, digest the sugars, digest the proteins. So our body has different enzymes, different substances like bile, hydrochloric acid, that's going to help digest our food and break it down into tiny pieces. Now, a lot of our kids don't have the digestive capability as, other healthy people, and that is going to leave undigested, unfermented foods in the gut. And what happens to food when it just sits around? It decomposes. It decomposes and it starts producing gas. So a lot of people who cannot digest certain foods are going to have a lot of gas. Now that gas can come upwards as burping. It can come downwards as farting. I love the British who call it northern wind and southern wind, which is amazing. They're always so much more eloquent than we are in America. But you're going to get a lot of that gas. And you're going to get kids with these big bloated belly. Okay, this big bloated belly is a sign of air, of gas. Okay, and that's undigested food. And guess what? That hurts. That air in our belly is uncomfortable. And many of us, who've experienced, bloating before, like, yeah, that's really uncomfortable until I get rid of the air and then I feel better. So, but our kids have such sensory issues that's going to cause pain for them, and a pain at a level where it affects their mood and behavior. So we need to make sure we're able to digest our food. And that can be things like I mentioned, bloating after food, the behaviors, but also something as simple as lactose intolerance. All right. Hey, I'm eating dairy. I'm not on a dairy-free diet, but my kid has behaviors after. One possibility is that they're lactose intolerant, and that gas and pain of the fermenting lactose hurts. Okay. Then we'll get into frank allergies. Now, allergies are run by a part of the immune system called IgE, and we need to know these medical terms, and I'll show you why in a minute. And food allergies are, pretty stereotypical and well known. You might get a rash on your face. You might have a full-blown anaphylactic reaction. You may have allergic responses and mucus in the gut. These are kind of stereotypical allergic symptoms to things like peanuts and shellfish and strawberries. Those are the common ones, but frankly, you can have an allergy to any food. So it happens. And those food allergies are easily tested. You can either test them by going to an allergist. You get like the million little needles, like a million little mosquito bites, and you basically get injected with those foods, and you see which one you have an allergic reaction to. Or you can do a blood draw, with your doctor at a regular lab and get these IgE allergy levels tested and analyzed. Okay. I highlight the word because a lot of people will just use that term food allergy as a global kind of term that just means I have a poor food response, or I have a bad response to a certain food. And when you start to talk to doctors about that, they're going to be a little bit nitpicky. We're like, well, this is an allergy, and you have something different, like a lactose intolerance, and it's just semantical differences, but they're all similar, where it's our body is not doing well with a certain food for a different reason. Perhaps I can't digest it, perhaps I'm allergic to it, or perhaps something else. So then we get things like food sensitivities. Now, food sensitivities are common because everybody has them. Everybody is sensitive to a different food. And the sensitivity, as you can see, is monitored by or is controlled by this antibody IgG. All right. And it's just a different part of the immune system that's reacting. But that can cause a lot of inflammation. Okay. Not allergic type of inflammation, but other inflammation. That inflammation can cause pain. That inflammation can cause skin issues. That inflammation can cause mood changes. So it's going to increase inflammation, and everybody becomes inflammatory with some food out there. There's always a food that, my body thinks that's the bad guy and starts to attack it. And that's where this inflammation comes from. There's something in our body. Our body believes it's foreign and says, I want to get rid of it. I want to attack it. So the immune system attacks it. And that causes inflammation in the body. And for our kids who have autoimmune issues, we might start to get global inflammatory processes. And this is how these diets do so well for our kids. Because if our kids have this huge level of inflammation in the brain, and that inflammation is being contributed to an inflammatory attack on a food, then we're going to have attacks everywhere. Okay. So this is why the diets work. If your child's very inflamed and you take away a food that the body is attacking and creating inflammation from, then global inflammation in the body goes down and your child improves. That's how these diets are working. Okay. Last but not least, we're going to talk about autoimmune reactions, which are rare, but they still occur. And so I'm going to talk about an autoimmune reaction like celiac disease. Okay. And this is an important one to understand, because celiac disease is a condition where our body thinks that that gluten and bread products with gluten are the enemy. And so our immune system attacks the gluten, attacks the bread products, and starts to destroy them. But our colon, or some people have a colon that looks the same to the immune system as gluten. So when our immune system attacks the gluten, it then destroys the gluten, but then looks at our colon and says, ooh, more gluten. It's not the same, but that's what it does. And it starts to attack the colon. And then we get our own body destroying our own colon, and that's called celiac disease. So you can get these autoimmune reactions where a food looks like a body part and our immune system gets confused. And the metaphor that I always use is, imagine there's a set of identical twins, or two people who are the same. I don't know if that's a set, but identical twins. And one of them commits a crime. One of them murders or whatever. And the police say, hey, we got you on video. The person who looks like this is the killer or is the criminal. And then you've got two people in the world who look the same. You're like, wait a minute, which one of you was it? It can't be both of you, but the police could perhaps catch the correct person or the incorrect person, but they look the same. And that's what's happening with these autoimmune conditions similar to celiac, is that, hey, the gluten and the colon look the same, I'm going to attack both of you. That's how it works. Okay. It's very similar to people who have strep reactions and have to get antibiotics at the dentist because they get heart disease. So what can happen is some people's heart looks like strep bacteria. So you get strep throat, the immune system attacks the strep, and then attacks the heart, and you got problems. Okay. So again, that's just kind of a global picture of how foods can cause problems with us and with our kids. You either can't digest it and it causes bloating and pain, or you're frankly allergic to it and you get histamine reactions, or the body thinks it's foreign and is going to attack it, but not attack it in an allergy way, but in a different way that causes different inflammation, and people who have autoimmune reactions from that. So that's kind of the general thing. So let me first kind of get into the science. But again, let me say this first is what can we do with our kids and diets? Number one answer is try them. Try the diets. Okay. And, you don't have to do it all at once. If you want to, if you're like, hey, you know what? I'm going to do the most intense diet of them all, which is GAPS, or I'm going to do something really easy, or really, I shouldn't say easy, really minimal, like dairy-free or gluten-free, just one thing instead of it all. Just avoiding one of those foods can be complicated. So I shouldn't have used the word easy, but less intense, I'll say. Okay. So if you're going to pick something, do it, and do it 100%. Okay. So this is definitely something I need to enforce with you guys. And some of you guys are ready to go all in all at once. Be like, we're going to go crazy town into GAPS diet and let's do it. And I just say GAPS because that's a very intensive diet. So, and if you want to do that, that's great. All right. And if you're like, I can only baby step. We got like 10 kids in the house and they're all eating different foods. We can only do like dairy free or gluten free. That's great. Okay. Do it, but do it 100%. And you've got to give it time. You've got to give it a month or two. All right. So wherever you are in your journey, pick that and do it and see what happens. And trust me, I've seen great results like this story about gluten-free. And I've seen parents who've done this diets for 2 years and get no change. All right. But you never know until it happens, period. Okay. You never know until you try it. So let's take a look at some research because there's a lot of different, scientific study. And of course, if you go to your doctor, most conventional doctors are trained in drugs and surgery. Okay. I don't know any conventional doctor who has thorough training in nutrition. So even though they are your doctor, they have not been trained on food. They've not been trained on vitamins. They are trained on drugs and surgery. So going to them for advice, you really don't get any medical advice. You just get their personal opinion on it. All right. So that's you got to go to the right place to get the right information, wherever that may be. So let's get into the research of it. And I find a lot of the research on diets isn't 100% because everybody's different. And not everybody's going to respond to a gluten-free diet. Not everybody's going to respond to a dairy-free diet. And you know what? If you took a look at people who had allergies and you took peanuts out of their diet, well, that would only affect the people who were allergic to peanuts. It wouldn't affect everybody. So if we look at autism and say, hey, let's take out gluten, well, it's not going to help everybody. But it's going to help the people who are reactive to gluten. Diets are so individual, and we can't say, here's a diagnosis that's not food related and avoid a food and that's going to help everybody. That works with peanut allergies. Hey, we have a group of people with peanut allergies. We take peanuts out. That worked. Or we have a group of people with celiac and we took gluten out and that worked. Or we had a group of people who were lactose intolerant. We took dairy out and that worked. So you can take food-based medical diagnoses and do research on them, but you can't take like, hey, here's asthma, and we pulled out dairy, and boy, it didn't work because that's not that's not a food kind of condition. So the diets can help, but everybody's different on which foods. So I hope I'm not repeating, kind of beating this horse. So let's get to the research. Here's a nice research study. I don't have too much research today, but it's fun to look at. Here's a research study on autism, gastrointestinal symptoms, and gut microbiome. We've heard this term microbiome. It means our probiotics. Many children with autism show abnormalities in GI physiology, increased intestinal impermeability, overall microbiome alterations, and gut infections. Moreover, They are picky eaters. And the existence of specific sensory patterns of autism could represent one of the main aspects in hampering feeding. Okay, so just kind of general introduction that, hey, our kids do have these issues. They are picky eaters because of their sensory issues, and that affects their diet. Okay, we know this. We know this. How about this? This one is autism-related dietary preferences mediate gut microbiome. And I pulled this out because this is something that I agree with, but is kind of going against today's pendulum swing. All right. Everybody loves to talk about microbiome. Everybody loves to talk about probiotics. But the question is chicken or egg, frankly. Okay. So here's the one about autism and microbiome. And what we have here, it says, can I read this? Autism restricted interests are associated with less diverse diet. All right, picky eaters. In turn, there is reduced microbiome diversity. Microbiome differences in autism may reflect dietary preferences, and we caution against claims that the microbiome has a driving role in autism. So I find this research study, I pull it up because a lot of people talk about, hey, probiotics and microbiome and autism and how they're correlated, but it is chicken or egg. Where does this altered microbiome come from? And as this research study talks about, and I believe for 20 years, your microbiome, your probiotics are there because they enjoy the foods you eat. So our kids are picky eaters. They only eat select foods. They don't eat a broad, varied diet in general. And that is going to affect our probiotics. So our probiotics stick around there because they like the foods that we're eating. Okay. And if you change your foods, you change your probiotics, you change your microbiome. Okay. The easiest way to change your gut bugs is by changing your food, period. Okay. Do probiotics help? Yeah. But diet works way better. Okay. So the more varied foods you eat, the more varied microbiome you'll have. And does that microbiome affect us and our kids and our brain? Yes, it does. But where's the chicken and egg? Okay. Is the microbiome in control, or is the diet controlling the bugs, controlling the brain? This is where it is. But I also have this picture here, which I really love to kind of show you how it all works. This is a picture of the gut and the brain, and it starts with undigested food. We talked about poor digestion. That changes your gut microbiome. That inflammation causes leaky gut, which causes pro-inflammatory cytokine in the immune system, impaired social communication, increased stress response, which then causes GI symptoms. And it's a vicious cycle. It's a vicious cycle of our body not responding to the food, not digesting it well. The food and that lack of digestion creates inflammation, creates leaky gut, creates inflammation globally, which then causes more GI problems. And we get this vicious cycle. All right. Let's continue. Here's a research study on, here's a review and a meta-analysis of benefits of gluten-free diet or casein-free diet for children with autism. Let's see some science behind it. All right, this one says significant reductions, those kids who are on a diet, have stereotypical reductions in stereotypical behaviors, improvements in cognition. So a gluten-free, casein-free diet can reduce stereotypical behaviors and improve cognition of children with autism. Period. Okay. Here's another one. This is comparing gluten-free, casein-free with Atkins or ketogenic diet. Okay. Ketogenic diet, great for seizures. Ketogenic diet versus gluten-free, casein-free diet in autistic children. And what does it say here? It says, oh boy, I can't read this. Sorry. Hey, you turn 50 and the eyes definitely go. Both diet groups, the ketogenic / Atkins, and gluten-free, casein-free, showed significant improvement in ATEC and CAR scores. Ketogenic scored better in cognition and sociability compared to gluten-free, casein-free. Modified Atkins, which is ketogenic, and gluten-free, casein-free diet regimens may safely improve autistic manifestations and could be recommended for children with autism. Okay? So again, that's kind of what these research is showing, is that these diets can work. Here's a research study on autism and celiac disease in autism. This research study said they found that those with autism, about 4% of them had celiac, where a healthy group was a little over 2%. So this research study said could be double the kids. Let me re-say this. The amount of kids who have celiac, there's going to be double that amount in kids with autism. So it's worth checking. It's worth testing. It's worth analyzing your child to see where they are individualized and reactive. We talked about digestion issues. How do you help digestion issues? With digestive enzymes. Okay, digestive enzymes are something you can take to help digest your food. Period. Simple and easy. All right, and here's a randomized placebo-controlled trial of digestive enzymes in children with autism. And what does it say? We've got the autism group receiving digestive enzyme therapy for 3 months had significant improvement in emotional response, general impression autistic scores, general behavior, and gastrointestinal symptoms just by digesting your food. Just by digesting your food, better emotions, better behavior, better GI symptoms, and better overall impression in autism. Because you're not having the pain, you're not having the inflammation, and you're getting more nutrients from your food. All right? Very simple medical basics here. All right. So let's get into that next question of, well, hey, what diet is going to work for my kids? All right? And that's a really tough question because there is no one diet for everybody. Okay, it's not that easy. I know people want that answer, but that answer does not exist. So you need to do some trial and error to get that answer. How do you do that? Either A, you experiment. You trial and error. You say, you know what, this month, no gluten. Let's do it. Let's see what happens. Okay? And you know what? A month from now, if my kid's fine or if my kid's just the same, well, you go have gluten again. All right. And this month we're going to do dairy. Or you know what? I want to go all in. I want to do Atkins. We're going to do 0 carbs. We're just going to load it up with protein and bacon. It's going to be delicious. All right. So that's number one. You've got to try these things. Now, are there tests out there? Yes, there are. You can get food allergy tests. Okay. Those are, like I mentioned, the little mosquito needles, with an allergist, or you go to your doctor and get a blood draw. You can easily test for food allergies. Food sensitivities, you can also test for. And again, we talked about the terms IgE and IgG, allergies versus sensitivities. There are food IgG tests. We offer one that's a finger prick, okay, through our website. And this is through Mosaic Diagnostics, who used to be Great Plains. They're going to do food allergy testing, things like dairy, things like grains, so many different foods are going to be on that test. I don't feel the IgG test is as accurate as the IgE test, but it's all we have. So if you like testing and you want a springboard for ideas, you try the IgG test. But I would not say it's 100% accurate. So you may avoid foods that are on there that were positive and not see a change. And the other way, you may have foods that you do eat and you do see problems, but that weren't on that test. And maybe it's because it's an allergy or it's a digestive issue or whatever. It's if you need a springboard for ideas, if you need something to show your stubborn husbands, and I'm going to call you guys out there because I'm one of them. If you need to show a stubborn husband something and say, hey, look, it's right here in black and white. My kid shouldn't eat that food. I find that the test is good for that. I find the test is good for motivation to start. But if you're all in, just go. Just pick a food, pick a couple foods, avoid it for a month or two and see what happens for your child. Like my patients, they may start talking within 30 days. I've seen it happen before. I've seen it not happen before. All right. Another of my favorite stories, I was at TACA at a Q&A session with one of my favorite autism docs, Dr. Julie Buckley. And we did a Q&A session up on stage and it ended and, people were coming up and asking questions. And this father came up and said, hey, I have a question for you guys. Should we try the gluten-free diet? And Dr. Buckley and I looked at him and said, yes. And he said, it's really hard. And we said, yes. And he said, should we do it? And we said, yes. And he said, it's going to be a lot of change for my family. And we said, yes. So we know it's hard. All right. We try to do dairy-free, gluten-free in our house. Right now, it's just mostly dairy-free. And it is a struggle. It's a struggle when you get out there in life. But what if it can help your child? Is it worth the struggle for your child? That's my point. All right. Let me get the coupon of the weekend. We'll get to some live questions. Coupon of the weekend is Diet 20. That's right. Diet 20 will get you 20% off any of our supplements, any of our labs on SpectrumAwakening.com that expires February 25th, 2024. Now, that could be for the food IgG test. That could be for digestive enzymes. I didn't show you what we had. I brought a few. We have 3 digestive enzymes. There's a lot of digestive enzymes on the market. We try to make ones that are good quality, that are gluten-free, dairy-free. We have one that's chewable. So we have a chewable digestive enzyme. It's a little thin tablet. It kind of looks like it's the shape of a pumpkin seed, but it tastes like papaya. So it's decently sweet. And then we have capsules. This is one called Super Digestive Enzymes. It's a really nice, comprehensive enzyme formula. This is what we have in our house when we don't feel good. And then for those people who do eat gluten, again, it's worth trying to not eat gluten. But if you do eat gluten, we have gluten enzymes. These digestive enzymes specifically digest gluten. Okay? So I would, if you are eating gluten, I would try these and see if you feel any different. Okay? I don't want it to be a crutch for you to be able to eat gluten if gluten's really bad for you, okay? It's not like if you have celiac disease, you can take these and eat gluten and be fine. It's not going to happen, but it's something to try. So those are some enzymes that we have on our website that they work well. We like them a lot. All right, let's get to some of our live questions. Again, I've only got about 10 minutes left, so I'll get to the questions that we can. Lindsay, can you take a yeast mold bundle if a child is already taking multiple ADHD meds? Yes, you can. And let me say this about med supplement interactions. The best person to ask for this is your pharmacist. Your pharmacist is the most knowledgeable about drug-herb interactions. The only ones that I would be concerned with from our website is any of our supplements with 5-HTP and taking antidepressants that are the SSRI category, which is the most common, like Prozac and Lexapro. That's the only one I would worry about, but ask your pharmacist. Kay from Kentucky, I hope Natalie's doing well. Carla from Florida, Rodney's always here. Hey, Rodney. We've got Julie. Hey, Julie, to fuel mitochondria, my son is taking Mitomax with ATP. Recently started Power and Focus that has ATP. Is it too much? No, I think it's fine. I think it's just fine. We've got Alyssa. I've been looking forward to a diet video, gluten-free for 2 years and progress with behaviors and language. Exactly. I want to do dairy-free, but it's too hard when they only said about 10 to 15 different foods. Yeah, it can be a struggle. Luckily, the dairy-free options are much more palatable, in my opinion, and easier than the gluten-free ones, but it can be hard. So do what you can. We're not perfect, all right? And this is where perfectionism can really get and affect us and affect our kids. You know what? I want you to do this 100% when you do it. But geez, if you did 6 out of 7 days, that's better. If you did 6 out of 7 days without dairy, that's better than 7 days with dairy. So you can't evaluate it until you do it 100%, but you can still help less than 100%. Jasmine, good morning. Happy belated birthday. We are thankful for you. Oh, thank you guys, Jasmine. I appreciate it. I'm thankful for you. Any parent who wants to help their kid. I am truly thankful for you guys. There's too many parents out there who don't try. That makes me sad. Karen, after being gluten-free, dairy-free for a long time, my son got a hold of a gluten bun and didn't talk for 3 days. Let me say that again. Karen said, after being gluten-free, dairy-free for a long time, my son got a hold of a gluten bun and didn't talk for 3 days. So lethargic and foggy, this stuff is real. It is. It is real. Let me tell you why you're lethargic and foggy. Some people, not all, some people convert gluten or dairy into an opioid, into a chemical that's similar to morphine. So it dopes the brain and it reduces pain. And that's why these things feel good, because it reduces my pain. Even if my pain is minimal, it still feels better on some morphine. All right? So that's why you're foggy. That's why you're lethargic. That's why they're addictive. Hey, Doc, would you be interested in attending a special education resource fair? Oh, wait, are you from SEPTA? Yes, I have to get your emails. I was away. I'm a little slow on emails, but I'll get there. It's always best to email our customer service. Email customerservice@spectrumawakening.com, just because my team is better at emails than I am. Michelle, good morning from Texas. Our nonverbal 16-year-old is staying up till 6 a.m. That's not cool. It's not that he's not tired because he's absolutely exhausted. It's the severe OCD. What are your thoughts? I want you to try our Calm and Cool and our Spectrum Tranquility supplements, Michelle. See if those can kind of calm down that anxiety. Aisha, what about anaphylaxis? We've done a lot of change in our diet, but I'm not sure that helps with anaphylaxis. If you're having anaphylactic symptoms, you've got to be reacting to something. Maybe it's not food, maybe it's environmental, but you need some full-on allergy assessment with an allergist to get to the bottom of it. Try that. Alyssa, what are the best foods to detox yeast and mold? Garlic, onions, fresh herbs like thyme and oregano. I would start eating the peels of organic oranges and grapefruits. I would go with that. Keisha, what's the difference between gut calm and gut immune access? Good question. I find gut calm is more of an energy product to get the gut calm is, I think gut calm is a better product. It's highly concentrated aloe with ribose. So you're healing inflammation and leaky gut and giving it the energy. The gut immune access affects more immune modulation in the gut, not as much the leaky gut. So they're similar, but I like the gut calm more. Diane, why do behaviors change when he reacts to bad supplements or foods? Pain from inflammation. Okay. And a lot of you are asking and have asked before, hey, I gave a digestive enzyme. I gave a probiotic. I gave a prebiotic like inulin and my kid got worse. What happened? What happened is you're starting to kill off these bad bugs and that causes pain. That's why we always need to push binders. We talked about this in our podcast a few weeks ago. Binders. You got to start there. Julie, thank you for sharing the story about the nonverbal kid who went gluten-free and became verbal. I have a nonverbal son, and this is an amazing story of hope. I know, Julie, I love it. These are the stories I need shared. These are the stories that I have that I want to share, and I need you guys to share your stories with other families. It's the only way we're going to encourage families to do something for their kids. Okay? Nancy, tapping on everything, verbal stimming, piano fingers, cuticle peeling, big-time mouthing. Is this yeast or parasites? Yes, it could be. There's a lot of anxiety going on there. I would treat gut infections. I'm just going to globally say gut infections. Unless certain overgrowth of yeast, mold, or bacteria can make you test allergic even if you're not, correct? So what Alyssa's saying is if I have a gut infection of yeast, candida, or C. diff, will I test incorrectly positive on allergy or food tests? That is a great question. I don't know. I've never seen any science one way or the other on that, but it's an intriguing question. Karen, would you recommend putting diet notes in child's IEP so the school has to follow the diet too? Yes. Get a doctor's note in there. Don't worry, the school will screw it up. But yeah, get it in there with a doctor's note. Leslie, will your chewable digestive enzymes cause tooth decay? No. Nancy, what causes craving for sour foods? That's a good one, Nancy. I saw that question. As the comments were going up a few minutes ago. I don't know. I like that question. I don't know the answer. I like questions I don't know the answers to. Live shout out to Mary. K, sourdough bread made from your own starter and made right is gluten-free, which you let Natalie eat, which you make yourself, which is awesome. Yeah, we can make a lot of these foods at home. Donna, hey doc, Katie has Down syndrome and I'm sure autism too, but I have been noticing after she eats, she starts crying. She's in pain. I've been seeing a lot of hair in her bed every morning. When I comb her hair out, I brush her hair. What do you think? Well, if you eat foods and you cry, it hurts. Start with the digestive enzymes. The hair on the pillow. Listen, please, Donna, listen. If you have a child with Down syndrome, if anybody has a child with Down syndrome, 90% or 95% odds they are hypothyroid. They need to be on thyroid medication. I would do it for my own kid. That's why their hair is falling out. Get them on thyroid meds. If they are on thyroid meds and the hair is falling out, talk to your doctor about adjusting the dose. Sophie is sharing with everyone. Thank you, Sophie. Haheo, you mentioned in the past that your folinic acid can help with speech. Yep. Does leucovorin do the same thing? Sometimes yes, sometimes no. I don't feel like leucovorin is effective. Can I try your formula instead? I would. And the difference, I believe, is, folinic acid and leucovorin are the same. However, leucovorin preparations can contain gluten and dairy, which can be bad. And our folinic acid formula, we've added cofactors to get more absorption into the brain. So in my opinion, it works better. But honestly, try both and use what works. That's what you guys got to do. Is it okay to give my son amino acids instead of meat? He hates meat. Well, no, because let me say beef is going to have things that amino acids don't, like vitamin B12 and iron. So he hates it, and I understand. So we do have to supplement protein, but there's other things that need to be supplemented. Brianna, my child's always had mushy stools, not diarrhea, but very unformed, and just mush. Started probiotics last week, and his stool is now formed. Do you think he's absorbing more nutrients now? Yeah, probably. Susan says cerebral folate deficiency, ? Try our superflinic acid. Hey, Dolly's watching, Treasure's watching, Zalika's watching. You guys are all regulars. Good to see you. Paula's watching. Paula says happy birthday. Thank you, Paula. Oh, the big 5-0, Paula. Lewis, I need an appointment. I need someone to speak Spanish. I do all telemedicine visits with people around the world. And there are many of my patients who will have a translator or an interpreter on the visit at the time. So we'll often be Zooming with 3 of us, myself, the family, and the interpreter. So if you'd like to do that, that would be the way to get it going. Retha, hey, Doc. Hey, doctor, I was your birthday, doctor. If my daughter with seizures has iron deficit, how can I help her, please? Well, if she has iron deficiency, you should be giving her some iron. And anybody who has seizures, try folinic acid. Okay. Kay's talking to somebody else. Dolly, can you give 3 scoops of Mitomax a day? Yes. What causes tiredness in the afternoon? Usually a cortisol drop. I would try some of our temper tamer. I mean, you can try an additional dose of Mitomax later in the day, see if that works. But I might try the temper tamer at lunch. Julie says, my son has constant constipation, started using castor oil, and it helped. It does. It's great stuff. We've been to a GI. He recommends Miralax. That's what they do, drugs and surgery. He has a blood test for celiac negative, allergy testing nothing, normal GI, IgEs. Now I wonder that my GP can't access his results right now. No mitochondrial issues. Never heard an explanation. Been using Mitomax Brown Log Train and the magic dose for Brown Log. Next step, stool test, SIBO breath test. Stool test. Do the stool test next. All right, guys, I got time for a couple more questions. Valerie, what do you suggest for an ARFID kid who has never eaten and is 100% Pediasure fed? Get off of Pediasure. It's corn syrup. Get on some kind of protein shake with a multivitamin and some omegas in it. Please. And I'm not I know a lot about nutrition and autism, but I'm not a nutritionist, and ARFID is kind of out of my league. So you may want to find somebody who's a little bit more knowledgeable. But I think Julie Logan is. She's out of the Chicago area. She's with Usman's office. All right, what do we got here? Michelle, this is excellent information. You're welcome. Mary, can digestive enzymes cause behavior issues? Yes, if you have a gut infection. So treat that gut infection. Is 1 egg a day okay? If you're not sensitive or allergic to them, yes. Diane, my son's belly disappeared after a digestive enzyme. Maybe I should try digestive enzymes. I need my belly to disappear. Santa asked about what we recommended. We recommended ours. Jeannie, do you have a gluten-free diet recommended, or you just Google a good one? I don't have anything on our website that really walks you through it. Liz, can digestive enzymes be given with other supplements? Yes, they can. All right. Jeannie, I use a chewable digestive enzyme on my 7-year-old. It worked great. I use super digestive enzymes for myself, and that works great. That's awesome. Aisha says happy birthday. People are sharing. All right. 3 more questions. I'm going to wrap up. Ida, which supplements interact with risperidone? None. But I wouldn't use our attention on the double because it's going to be rendered ineffective by the risperidone. Cindy, when is the broccoli extract going to be back in stock? I need to double check on that. Last but not least, Carla, is there a diet you would recommend for Candida? Yes. I am not in the camp to avoid all sugars. I say eat healthy sugars, like fruit. Fruit's a healthy sugar. You don't have to avoid that, in my opinion. So what I would say is more garlic, more onions, more fresh herbs like oregano, thyme, and I also mentioned the peels of organic oranges and grapefruits. That's going to be killing the Candida. The avoiding sugar just starves it, and frankly, that's a long, frustrating journey. So anyway, I hope this all helps. We're wrapping up our podcast right now, a little bit earlier, but let me sum up. Diets are important, and diet is a 4-letter word, but some of us react poorly to certain foods, and we need to know that for ourselves and for our kids. And regardless what our doctor says, you know what? When I eat this food, I feel bad. Don't eat it. That's it. Just don't eat it. Okay. You can try digestive enzymes, but if you're going to try a diet, try it 100% for a month or 2. Be all in and see if it works.
Sometimes it does. Like I said, we've had kids talk on these diets, and we've had people do it with no change. Everybody's different. It's not hard. It's a long journey. It can be hard, but you've got to try sometime in your kid's life. Okay? Maybe not today. Maybe today. Maybe not today. Maybe tomorrow. Maybe today. But find a time and do it. All right? Good luck, everybody. Hey, coupon of the weekend is Diet 20. If you want to get the food test, you want to get enzymes, you want to get anything, we got it there. I hope you all have a great week. I'm going to have a birthday week, so I hope everybody has a good time. We'll see you later, everybody.